Well, CAR T-cell therapy has been demonstrated that it has a lot of activity in relapsed refractory pediatric patients with acute lymphoblastic leukemia. Although there is not much known about extramedullary disease anti-leukemic effect of CAR T-cell therapy, because extramedullary disease patients have been always excluded from these CAR T-cell trials. Those patients with isolated extramedullary involvement are not allowed to be included in many of these trials. So we wanted to evaluate if CAR T-cells have an effect against the extramedullary compartment of ALL. And we analyzed in our series of patients treated with a 4-1BB CD19 CAR T-cell, either CTL019 or Kymriah, or an academic CAR T-cell, which are RE cells, which are also CAR19 4-1BB. If among these patients, if we found differences between those patients having extramedullary involvement recently before CAR T-cell infusion against those who didn't have, to see efficacy and toxicity. So we analyzed our 34 patients treated, consecutive patients treated with these two CAR T-cell constructs, and we compare the results of these two cohorts. And among 34 patients, there were 16 with extramedullary disease and 18 without. And we didn't find differences in the incidence of neurotoxicity or cytokine-release syndrome. Even in those patients with CNS involvement, they did not present more severe neurotoxicity than those without this involvement, which was one of the concerns about including these patients in these trials. And on the other hand, we observed the same complete remission rate and the same outcome. So we really think that we should go for to treat these patients. Also include the patients with isolated extramedullary disease. And that's the main result of our study. I would like to thank to all the team, and especially to Dr. Ana Alonso, who was the first person involved in this study. And we are looking forward, and it's something that many clinicians have asked us after the talk about the possibility of treating this type of patients.